very common question I get from all my patients is how long will I take to recover after hip surgery? Now, if you looked at people who have had hip surgery 10 years or 15 years ago, there will be lots of pain, they are miserable, they are on crutches for months and months. I'm quite happy to report that in the modern orthopedic world, this is not how a hip replacement is done anymore. With enhanced recovery techniques, we get patients walking on the same day, immediately after surgery. We have them staying in the hospital for 2 or 3 days to make them walk better, and subsequently they can go home with the use of minimal assistive devices. Now, what are we doing so differently that allows us to achieve these results? Enhanced recovery after surgery is performed with a combination of techniques including proper anesthesia, the adequate use of painkillers, as well as the surgical technique. Now, the surgical technique is very, very important because traditional approaches to the total hip replacement involves the cutting of muscles around the hip to approach the hip joint. With modern muscle sparing techniques such as the direct anterior approach, this technique allows us to approach the hip joint by gently pushing the muscles aside and allow us to see the hip joint and perform our surgery. By not having to cut the muscles around the hip, the patient is able to walk faster, recover better, and return to their activities of daily living much faster than the traditional techniques.